All right, a few of you have asked me to talk a little bit more about tinnitus and what it is and so on, so here goes. First, tinnitus, broadly speaking, is just the term for when you hear a sound, often a ringing noise, even though there isn't an external cause for that noise. So it doesn't count as tinnitus if you have really good hearing and you hear something that other people don't. Now, broadly speaking, there are a few main categories. The first and most common is what we call subjective tinnitus. That's where you are hearing something even though there's absolutely no source for the sound whatsoever, and that would be in contrast to, say, objective tinnitus, where there is a source, but it's in your body. And an example of this is something called the cervical venous hum, where due to slightly abnormal blood flow in the jugular vein, when somebody turns their head in a particular way, they can hear the sort of eddies and currents of the blood flow, and it comes across as like a sinister hum that a doctor could actually hear with a stethoscope. For the subjective kind that's due to some kind of neurological issue, it could either be peripheral or central. So you can either have damage to the peripheral ear system or something going on in the auditory processing in the brain. And the most common kind is associated with hearing loss, typically the age-related kind. And this is thought to involve both changes to the peripheral system. The hearing loss itself is usually peripheral, caused by the dying off of parts of those inner ear hair cells, the ones that vibrate when sound comes in, and central stuff happening at the same time, like I talked about in my last video. And this is also the kind we think is associated with medications that can cause tinnitus, because those medications are called ototoxic, meaning they cause damage to the ear system. An example would be chemotherapy meds can be ototoxic. And that damage can result in hearing loss, the tinnitus that comes with that hearing loss as the brain kind of adapts and tries to compensate for the sudden change, and even adjustments to motion and balance, because a lot of that happens in the ear system as well. And what's unfortunate is, while the objective tinnitus can be identified and sometimes even addressed, the subjective is a lot harder to treat because we're not entirely sure what the heck is going on that leads the whole system to say, hey, now I'm going to let you listen to this loud tone all the time. But there's definitely an attentional piece as well, which means that as you attend more to it, the brain trains itself to pay more and more attention to it, thinking, hey, that's an important input. And that in turn can lead to anxiety and depression regarding the tinnitus, which can then create a positive feedback loop that makes the tinnitus and the emotional feelings worse and worse. And that's why you'll also see a lot of treatments for tinnitus focus on that emotional part, because if you get the depression to pull back, the tinnitus can pull back as well.